Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening Birmingham. Today I have the honor and pleasure of being back at the Urology Centers of Alabama with Dr. Michael Bivens.
How you doing, Jarvis?
Great.
Good.
We are here to talk about prostate cancer. September is Prostate Cancer Awareness Month, so I wanted to bring on the good doctor to kind of talk about this very important topic. And I have a long list of questions, so the doctor is ready to answer it. So Dr. Bivens, thank you again for coming on the podcast.
Yeah, absolutely. Thank you for having me here. And again, I thank you for being able to put this out that educate people. And I think it's important that we talk about this subject and we get men educated. And I think once they're educated, we can get them treated, prevented, and all those things we need to do to help fight this disease.
All right. So before we start, I just want to kind of give the doctor an opportunity to introduce himself to the audience.
Okay.
How long he's been?
So I am Mike Bivens. I'm here at Urology Centers. I've been here at this group for about 17 years. I'm from Lower Alabama, where I graduated high school, went to college at Alabama Roll Tide.
All right.
Went to med school here at UAB. I completed a urology residency at the University of Oklahoma, and I went on to do a fellowship in urology oncology, where that focuses on cancer of the urinary tract, to include prostate cancer. And I did that for a couple of years, and now I've been back in this group 17 years, and one of my areas is prostate cancer.
All right, so what is the medical definition of prostate cancer?
So the prostate is a gland that only men have, and the purpose of the prostate is it's a fertility organ. If a man did not have the prostate, he could not fertilize a woman. And so, and then cancer is when that gland turns cancerous. And what I always tell patients is that when people always wonder, what is cancer? You hear that big C word, and people, it frightens people. But what cancer is when the organ turns, so a normal organ, whatever that is, it obeys a certain laws of the body. You get cell growth, cell death. And it's when there's a disruption in that sort of kind of balance, where you get more growth than death, that turns into a tumor, and then it stops obeying the laws of the body, and it can grow and it can take over organs, and then it can eventually lead to death. And that's what cancer and prostate cancer is.
So what are the symptoms?
So, it's interesting that in, a lot of different organs and a lot of different cancers have symptoms. So if you take lung, people are coughing up blood. You take colon, people have blood in the stools. You can take a bladder, blood in the urine. You can take a brain cancer, they may have dizziness, seizures. Prostate cancer, typically you don't have any symptoms at all. And that's why these programs are important, so that we can go and we can get people educated to go get screened. Because if it's not going to tell you it's there, then we have to go look for it.
All right, I was doing a little research before I met with you.
Okay.
And one of the biggest things I read about more and more, so is prostate cancer hereditary?
So there is a genetic form of that. We know that men that have fathers and brothers, so it's on the paternal side, then there are 3 times the risk of developing prostate cancer. There are some genes that are also associated with prostate cancer. So yes, there is a genetic component to that. So if you know of someone in your family that has prostate cancer, then you definitely need to go get screened. You need to go see a doctor about being screened for prostate cancer.
Can you stress more the importance of early detection of coming in and checking it out?
So we know that. I mean, not beyond just making sense. We know that when you screen men early, you are going to find cancer early, you're going to cure men, and men are going to live longer. And we know that if you go back to before we had the screening process, men were showing up with prostate cancer that was much more advanced. People were dying at a higher rate. Then roughly around the mid-90s, when we started screening people, then that death rate just went out, it just dropped. And men we start being able to find them earlier and getting them back to a normal lifestyle. So in order to do that, you have to get in, we have to get you screened, we have to get your prostate checked, we have to get the blood drawn. All of those things will lead a man back who has cancer back to a normal lifestyle.
All right, so the next question I'm going to ask you is, I know a lot of guys kind of be afraid, but you need to know this. How do you all check for prostate cancer?
So prostate cancer, obviously the first thing you do is you're going to have a conversation.
All right.
And so, when I talk to a man and I want to know, is there a history of prostate cancer? I'm going to want to know, are you, what's going on with you? Are you urinating okay? All these things. Then we're going to get a blood draw. That's important. And that blood draw is a PSA. And so the letter S, and the letter A. And then what it stands for is prostate-specific antigen. That's a chemical that's made by the prostate. And it should be in a certain range. And when it goes above that range, then that means that we need to look at you a little closer, which means that we may need to biopsy you. And then the second part of that evaluation is going to be a prostate exam. Now, that makes men a little bit leery sometimes, but if you get a man in, you get him comfortable, and we do a prostate exam where we have to use the finger test to feel the prostate. And what we're feeling for, we want to make sure it feels normal. Normal prostate should feel like the back of my hand.
Right.
And what I don't want to feel like my knuckles. That would indicate cancer. And so that's why we want to prevent it from getting to that point where we're feeling like my knuckles.
All right, so I hear this next question.
Yeah.
Everybody have different opinions.
Yeah.
Excuse me. Is what age should men come in to get checked?
Well, and again, that's very controversial as to how early should you start. So what we tell patients is we roughly tell patients 50 at the age of 50, unless you are an African American or if you have a family relative. And in that case, we usually stress 40 years old.
All right.
And so that's when they should start. And it should occur yearly. Sometimes I hear somebody tell me, I got checked 3 or 4 years ago. And then, cancer will pop up, and now they've gone 2 or 3 years without even, it is growing and without it being, treated. So it should start at the age of 50, unless you're African American or you got a family relative with cancer, and then at the age of 40, and then it should go yearly after that.
How do you feel about, I was doing some reading last night,
Yeah.
and sometimes people's we'll do the wait and see.
I think that, the first step to any treatment, to anything, is education.
All right.
And knowledge.
Okay.
You got to have information.
Mm-hmm.
And so, not all prostate cancers need to be treated, as a matter of fact.
All right.
There are some cancers that you can watch. They are slow growing cancers, and that cancer may, you may succumb to something else. So that cancer may not need to be treated. Mm-hmm. But the only way you're going to know that is with information. Mm-hmm. And the only way you're going to get that information is coming in and being screened. So I think the wait and see, you can use that if you have appropriate information, but the only way you're going to get that information is coming in and we do an evaluation.
So what's the difference between an enlarged prostate and prostate cancer?
So the prostate gland can have several issues or several problems. So, and the two most common are going to be enlarged prostate or prostate cancer. Now, an enlarged prostate is where the prostate gland grows, and as it grows and gets larger on the outside, it can get larger on the inside. And so, as it gets larger on the inside, it starts to clamp down the flow of urine. And as it clamps down the flow of urine, men start developing symptoms. And the most common symptoms are going to be getting up at night, frequency to urinate, urgency, straining to urinate. And if you're having those problems, then you need to go seek a medical attention. Go talk to your doctor about it, because there are medicines to treat that. Now, that's not cancer. Typically, prostate cancer, it occurs on the outside of the gland. So it's going to occur away from where the urine flow, so you're not going to have any symptoms. And so that's why you can't wait until you have symptoms. In prostate cancer, if you wait until you have symptoms, you've waited too long. So if prostate cancer occurs on the outside of the gland, away from where the urine flows through, such that you're not going to have any urinary symptoms, then you must go in. And again, you can't wait for it. You have to go in and get screened, and that's why going to look for it is important. So those are two differences between those particular issues.
So we're here at Urology Centers, Alabama.
Yeah.
What specific treatments do you all offer to prostate cancer?
For prostate cancer. So if a man has prostate cancer, he may not need any treatment at all, and we may follow him. And if we follow him, that may repeat his PSA, we may repeat staging, we may repeat MRIs, biopsies. So just because you have cancer doesn't mean you need to have a treatment. So by just following that man, that is a treatment. So that's one treatment. And then there are other, we offer the entire menu of treatments, and we'll tailor that with a discussion with the man and figure out what's most appropriate. So that can be anywhere from surgery, where we do robotic surgeries, and I think in our group we've done about 12 or 13,000 robotic prostatectomies, a large volume, and I'm not sure the exact numbers, but I know it's constantly growing, maybe even more than that. We can do radiation, and it's pretty, and again, that's pretty specific pinpoint radiation that allows for destruction of the cancer without harming other normal tissue. We can do radiation seeds, where we put these little pellet seeds into the prostate gland, and it kills the cancer. We can do cryotherapy, which we freeze the prostate and thaw it out, and freeze and thaw it out, and that is what kills cancer. We can do ultrasonic treatment of the prostate. It's called HIFU, which is high intensity focal ultrasound, in which we use ultrasound waves to kill the cancer. We can do chemotherapy if a patient needs chemotherapy. We can do immunotherapy, where we take their own immune system and fight the cancer. So we have the entire menu of options, and through appropriate evaluation, conversation, looking at the patient's goals, we can come up with a treatment plan for the patient.
And I apologize if I asked you this question before.
No,
I
go
want to
ahead.
make sure I don't miss. What are some of the risk factors for prostate?
Great question. So the number one risk factor, or I should say number one, but risk factors would include race.
All right.
Being African American puts you at a higher risk, puts you at over 2 times the risk of prostate cancer. And also with African Americans, they have a higher morbidity and higher death rate. They are diagnosed with higher volume cancer. That means they have more cancer. They're typically diagnosed at a higher PSA. So all those things, when it comes to African American, carry a more aggressive form of the cancer, and that's why, it's particularly in that population of patients, we got to make sure we get those men screened. But family history is another risk. Where you're located in the country, we don't really know why that environment makes a difference. But those are some of the major risks of prostate cancer.
How about food and food?
Yeah, and we don't know how that plays into part. We know that area. So that goes back to what I was saying earlier, where you're regional, where you're located. They typically will have higher fat diets, and we know that gives you overall higher risk of all cancers. And so when you look in the South, that typically will have a higher fat content diet, that they have a higher incidence of all cancers, and within that, a higher risk of prostate cancer. The problem is we don't know what to do with that and how that fits into our evaluation and treatment.
All right, well, I'm glad we asked that question. Do a segue, since how does Alabama rank when it goes to prostate?
So historically, United States Preventive Task Force came in, and they did an evaluation, ranked different states, and they gave us grades, and we looked at the way we screen patients, the way we evaluate and treat, and overall, a few years ago, we got an F.
All right.
Now we've up to a C.
Okay.
We still rank a low among other states. We're not the lowest. The last time I checked, I think we were ranked 11, one being the worst.
Oh, wow.
So I don't look at that as a bad thing. I look at that as opportunity there.
All right.
And I think that what we try to do here at Urology Centers of Alabama, we have a screening where we go into the areas that are at risk, or most at risk throughout the state, areas that may have not the best medical systems, and then we try to offer free screenings. And we think that has helped improve our that ranking from an F to a C, and so what we try to do is make sure we can reach out to men, get them screened, and then what we do is, so then you get them screened, so then you diagnose somebody, then what are you going to do?
Right.
Well, we try to take them to completion. We try to be able to offer them either the surgery, the radiation, or whatever treatment that they may need. So there's no sense in us diagnosing somebody and not being able to help them and treat them. So we're still trying to do, and we are trying to, just keep educating and getting more people involved, getting more industry involved, getting more corporate partners. So because it's a community issue,
Okay.
and it's a society issue. And so everybody, in order to beat this thing, in order to win, everybody has to be involved. And so,
And one thing I like about you say you do a lot of screenings, community screenings, go out and test people for it.
that's right. All right, we do, and you know, and we find, you know, I mean, it's a lot of disease out there, and we're trying to find it. We're not there yet, and we're still trying, and we're asking all of you out there to help, and the way you can help is, you know, volunteer, talk about it, ask men that you know, men over 40, you know, ask them if they know what their PSA is, and if they don't, the next question is, or the next statement is, tell them to go and learn and ask, and to go and ask their doctors if they've drawn one. And you know, you actually, you'll be amazed at some of the physicians that don't even bother to even test or screen for the PSA. So sometimes we can be our best doctors. And so you go out and you ask what you ask for your own PSA, but ask your friends if they know, and if they don't know, to challenge them to go to their doctor, go to the doctor, and then challenge them to ask their doctors, have they drawn the PSA, and if they don't, request that they do it. And so that all, again, information is the first line of treatment, and information is where we're going to find the cure to this thing.
All right, and this is my last question. I didn't even have my list question, but it came out, and I know this is the elephant in the room of guys that's watching the video.
Yeah.
How does prostate cancer affect your sexual activity, or is there a possibility you can actually get it back after certain?
So it's a lot of misnomers there that we probably need to kind of work through.
Okay.
And so it's amazing when I talk to men, they think that prostate cancer lose sex.
Okay.
And the reality is that that's not the case. You know, a lot of men are going to have problems coming into this thing.
All right.
And so I try to separate those issues out and address them individually. So if you look back at the 60s, 70s, and 80s, your surgeries were not as good as they are today. And what happened was, anatomically, when you go in and operate, you were destroying nerves that affected, you know, the man's sex organ. And so, and the same way with radiation.
All right.
And so it got to the point that men they didn't even want to go get diagnosed because they linked getting diagnosed with surgery.
All right.
Which you don't necessarily have to. Again, we talked earlier. Some of the treatment options maybe it's just watch, but they link that with losing. If I get diagnosed with cancer, I'm going to lose my sex life.
All right.
And so what we're trying to unlink that and saying, no, we want you to get diagnosed so we can give you information. That's all we want to do. That's the first step. And then as you start talking about treatments, what we've done is we've leaps and bounds from where we were 30 years ago.
All right.
The technology is different. Our knowledge base is different. Our understanding of the anatomy is different. Our radiation is more pinpoint and different. So if a man has a good reserve and he has good erections or good sexual lifestyle beforehand, and we are able to do surgery, radiation, or any of these treatments, then we should be able to preserve that. And it may go down a little bit initially, but he should be able to get back to a good sexual lifestyle. Now, let me not even pretend here. There's going to be changes.
All right.
And I always say this here. A dead man doesn't have a good sex life.
Oh yeah.
Okay. And so it's important for us, you know, to preserve him, because what we have here at urology centers, we have a fully integrated clinic that can help you with your sexual lifestyle. We may have to do some things different than you've done before. That's okay. But we can get your sexual lifestyle back. And that's what we want to focus on, because what we don't want to do is lose men at the door, because that, you know, it affects their, you know, sexuality, or mentally, then that affects their perception of their sexuality, their masculinity, all these different things. We don't want that to prevent them from coming through the door, because no matter what happens, and I tell my patients, I'll tell you this right now, no matter what happens, we can get you back to a sexual lifestyle, okay? That can occur. But the first step is, let's get you the information. Once we get the information, we're not saying we got to do anything other than acquire and obtain the information.
All right. And this is the most important question. If they would like to get in contact with you,
I'm always available now, Chuck.
Okay.
You know, if you want to, you know, you can always go in. Our office is 930-205-930-0920. My secretary's number is 445-0255. You can go to our Urology Centers of Alabama and book an appointment. Just put the search engine on the Urology Centers of Alabama. It'll take you to our website, and you can always come and see me. I take care of everybody.
All right, and we'll have the contact information, but I just wanted him, him say it directly. So, Doctor, thank you so much.
Hey, my friend, you keep up the good work, Jarvis.
Thank you. Well, thank you. I really enjoyed. This is my third time coming to you all, and guys, it's state of the art. Like any problem going on, from the I'm not gonna say like the car approach, from the hood to everything around, you guys pretty much handle when it comes to men's health.
Well, that's an interesting way to put it. I guess that from the hood to the trunk.
Yeah. And the statement I always make in all my videos, I sit down with the doctors is, what you don't know can kill you, but what you do know can save your life. So,
that's right.
Doctor, thank you so much. Thank you all for watching this video. Please check out what'shappeningbirmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank y'all again, and have a great day. Bye-bye.
Bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.